I've struggled with this my whole life. It just made me so insecure. It's life-changing. Thank you, Dr. Lebowitz.
He looks great. This garment he's going to wear for about 6 weeks. This is a dressing change. Lift up that. Grab in the front. Get it over your head. A little sore for the first time or so. Oh, where are we? Where are we? There he is. Nice and dry, nice and beautiful. So get this baby offy. And there you go. The tape. But look how absolutely beautiful that incision is. And again, look how absolutely beautiful that incision is. I don't use drains anymore, as you can see, because my results are perfect. A little alcohol. But what I do, because any fluid collection inside will create scar. So what I do is I've got these are sterile, it's a little tweezer, and I just kind of poke at the edge of the wound, and there's always a little fluid there. Little fluid that I just literally poke out. Very gently and slowly. And that averts any drain. And again, the area where I did that doesn't really have any. Now you should perfectly, just a little fluid, just poke right there. And I find that drains don't even work. And a little indentation is normal, because what happens in my experience is that scar tissue always forms. So if you don't have that little indentation at first, and scar tissue forms, there'll be more puffiness, and people think that the gland recurred. But really, it's just the scar tissue. So what we do is just through here, and I know that scar tissue will form and fill that little cavity in absolutely 100%. So it'll be absolutely perfect. Poke a little bit at the end, and just a little fluid there, not much. This side is not much at all. So my quilting stitches and stuff. You alright?
Yeah.
Good. Absolutely perfect. So that little indentation up there is absolutely normal, because scar tissue will form. And if I don't do this, it'll look puffy. Also, if you look at bodybuilders, when they lift up their arm, well, the top, there's a little concavity there. And when they stand up and this muscle fills into the space, it looks perfect on that. It looks absolutely perfect. So a little more fluid on this side, but nothing bad. And if there's any fluid in there, when I Skype or FaceTime with him, I can actually send a little needle, and you can actually poke it right here. The needle is short enough that it's not going to hurt any muscle or anything underneath there, and we can drain out a little seroma if that occurs by FaceTime or by Skype. But there shouldn't be anything. I'm going to give him a roller. He's going to roll this to flatten. It's still a little swollen there because it's only, a day or two out now. And that looks perfect. And he's just a day out. So he looks amazing. Still swollen around there, The high definition looks will take a little bit. So I've got these specially made gauze. Boom.
Had my procedure done under local, no complications, no issues. It was very comfortable in his office. Dr. Lebowitz is very thorough, knowledgeable of what he's doing, which made me feel comfortable. His staff was great. 2 days outside of my procedure, a little bit of soreness, but I feel pretty good about it. Feel pretty good about the results. Chest is flat. Confidence is already coming back. So, good times.